Members of the press, citizens of Kenya. Today, the Council of Governors held an extraordinary council meeting to discuss the aforementioned. This is a follow-up meeting pursuant to the extraordinary council meeting held yesterday, 1st of September 2025. We invited the Ministry of Health, the Social Health Authority, as well as the Public Service Commission to deliberate on issues affecting the county government. Following the extensive discussions that we've had, we wish to address as follows. 1. On validation of UHC staff. It was observed that the UHC staff verification exercise undertaken by the Ministry and the Council of Governors has not been finalized jointly. We have therefore resolved that the Joint Technical Committee involved in the exercise immediately convenes to validate and finalize the report. The report is to be ready by Friday, the 5th of September 2025, and is to be co-signed by the PS Medical Services and the CEO of the Council of Governors. 2. On the transition of UHC staff on permanent and pensionable terms. The transition of UHC staff to permanent and pensionable terms. The Council of Governors and the Ministry of Health reaffirmed the position that in the interest of the UHC staff and the public, that transition would only happen on the following conditions. That the requisite resources to transition, which is Kenya shillings 7.7 billion, is availed to county governments through the Division of Revenue Allocation Act and the county's equitable share of revenue increased. The Council of Governors and the Ministry of Health will work collaboratively to resolve all pertinent issues concerning UHC contracts, and in this regard, a committee consisting of the chairs of Health, Legal, Finance, Human Resources Committee of the Council of Governors, and which will be also, it will include His Excellency the Governor of Makueni County. So I'll take that again. In this regard, a committee consisting of the chairs of Health. Our Chair of Health is Governor Muthomi, seated next to me here. Our Chair of Legal, Governor Achilo Ayako. Our Chair of Finance, Governor FCPA Fernandez Barasa. Our Chair of Human Resource Committee, who is the Governor of Nairobi, Governor Arthur Sakaja, and also His Excellency, the Governor of Makueni, Governor Mutula Kilonzo Jr., will engage with the Ministry and the Union on modalities of paying the UHC workers at SRC rates for the remainder of their current contract. So basically, I want you to get this right. What we are saying is, we would want not to lose the money that's already available to pay these workers at the SRC rates. So this committee, together with the minister's team, will sit down with the stakeholders who are the representatives of these UHC workers, and we agree that their contract runs until the end, which is for most of them April, May 2026. But in this intervening period, we pay them at the SRC rates using the money that the ministry has. And then we transition them to permanent and pensionable if the 7.7 billion to maintain them on permanent and pensionable in perpetuity is included in the next DORA. That's our only condition. Delays in reimbursement on claims from SHA. This is item number 3. The Council of Governors and the Ministry of Health unanimously agreed to roll out a governance dashboard detailing payments of claims from SHA, Social Health Insurance Fund, to county facilities. Currently, counties are owed upwards of 6 billion shillings in unpaid claims. The meeting agreed that all claims should be paid by 14th day of every month. We urge the Social Health Authority to expedite the payment of the pending claims to ensure continued health service provision in public facilities. Number 4, ambulance and evacuation services. It was reported that SHA has made a proposed framework for ambulance and evacuation services to critical patients and interfacility transfer for maternal emergencies. While we appreciate that the conceptualization of the proposed framework, the Council guides that the rollout of the same should be done at a later date. This will allow for consultation between the two levels of government on its operationalization. We appreciate the role of SHA in this, but you will also reckon that ambulance services is a devolved function under Part 2 of the 4th schedule of our Constitution. So we want to give time for consultation so that we agree on the modalities of operating this ambulatory service under SHA. 4, on career guidelines for healthcare workers. We have had an agreement with the Public Service Commission on the career guidelines for various health cadres. These were changes that were made without consulting and involving the county governments, and this is the agreement that we were able to extract as a result of that meeting. Asanteni sana, Mungu awabariki. But before I invite questions, I want to give the Minister an opportunity to also say something and to concur with me that whatever I've said is what we've agreed. Thank you. Was it? Okay. You can change it.